production of Speak Your Mind is made possible by the Human Development Center. Comprehensive behavioral health care. If we don't, who will? Learn more at www.humandevelopmentcenter.org. Additional support of HDC provided by
Depression. It's a mental health issue we've all heard about, but did you know the World Health Organization predicts it will be the fourth leading cause of suffering by the year 2020? Find out more about this illness and the latest and most effective treatments tonight on the season premiere of Speak Your Mind. Welcome to Speak Your Mind. I'm Dr. Carolyn Phelps, licensed psychologist with the Human Development Center. We begin a new season, our fourth season, with a discussion about one of the most common mental health issues worldwide today, depression. It is for us a great place to start because this program is all about helping people learn about mental health, mental illness, and most importantly, how to get help when we need help. Now, if you've been with us in past seasons, welcome back. We've missed you, and I hope you had a good, I won't even say spring because we had no spring, so let's just skip that part and go right to summer. And if you're new with us, welcome to our show, and we hope that you stay with us the entire season. Now, what you newcomers don't know is that we actually make your work out there because we depend on your questions to help explore this issue. So call the numbers on your screen right now, locally. Dial 218-788-2844 or call toll-free at 1-877-307-8762. And you can also email them using the address listed at the bottom of your screen, and we'll be answering your questions throughout tonight's show. We have great guests for our Season 4 premiere. How else would we start our season? Dr. Steve Bauer is the Chief Medical Officer at the Human Development Center, and he's board certified in child, adolescent, and adult psychiatry. And Dr. Dan DeAllard is a licensed clinical psychologist with the Duluth Psychological Clinic who conducts psychological evaluations and provides therapy to a broad range of clients, including those who suffer with depression. Thanks to both of you. And thanks for opening our fourth season. It's kind of like being a senior in high school. I can't believe it's been 4 years already. But I think, you know, this is what we like to do when we're talking about a specific mental illness. What we'd like to do is start off by getting everybody on the same page just to know what the symptoms are. So, Dr. Bauer, start off and tell us, what are the symptoms of depression? Depression, the illness.
Gladly. Depression is something that we look for by using a series of symptoms, and those symptoms create a syndrome. So having more than 5 of the 9 symptoms for more than 2 weeks may constitute a major depression if your function is impaired. And those symptoms are sleep problems, appetite problems, energy problems, concentration problems, crying for no reason or crabbier than usual over nothing, hopelessness, helplessness, suicidal thought, loss of interest in your usual activities, or loss of interest in sex.
And feeling guilty, excessively guilty for things that really aren't yours to feel guilty about too. Is that right, Dan?
That's right. Self-esteem impairment is one of the diagnostic criteria, but it also is predictably decreased when your functioning decreases and when you're impaired in so many important life areas. So yeah, that's a key indicator.
Yep.
And I think what I like about what you said too, Dr. Bauer, is the irritability, because a lot of people don't experience themselves as being sad or depressed, but what they will experience themselves as is just being grossly irritable to the point where they can't even stand themselves.
Very much so. I talk to a lot of people who don't experience themselves, and you know, we always say subjectively, but your own opinion of how you come across to other people isn't sad. But when I tell them the symptoms and they say, boy, I have 8 of those 9 symptoms, quite often they're dealing with it. But their way of describing it is something else. It's I'm hurting, I have pain, I have other reasons for feeling this way.
And so let's talk a little bit about that notion of pain and medical illness and how that affects people's perception of mood, or how that affects their perception of psychological distress, because sometimes people don't experience themselves as psychologically distressed.
No, they don't. It's a different experience of pain than, say, the physical pain that comes from physical injury. And so people's habitual ways of understanding themselves, their threshold for identifying pain or distress, is really something that a clinician has to assess when diagnosing depression. A lot of folks, as Dr. Bauer said, will clearly say they suffer from the somatic and the thinking, et cetera, difficulties associated with depression, but won't identify themselves as distressed in a way that they would if they cut their leg. And so that's part of where a skilled assessment comes in.
And what we're often seeing, I think, is, and I know in my practice, where somebody comes in and you say, well, why are you here? And they say, well, I'm here because my wife said that I'm depressed.
Yes. Quite often, it's very difficult to have that perspective yourself. And those around you are quite often a better barometer, particularly, we talk about Duluthians being primarily Scandinavian and having that Nordic sense of quiet, reserved way of interacting with folk. And that certainly has been something, my experience working in all parts of Minnesota, there are lots of folks who fit that description, and it's really their family members or friends that recognize in them that they're distressed or different at this point.
And the difference between kind of the normal blues that we all feel from time to time, Dan, and depression, the illness.
Yeah.
Sort that out for us.
Dr. Bauer used the key word earlier of impairment. Mood ups and downs are part of life. We'd be worried if you didn't have them from time to time. But the degree of impairment is the key issue. If the mood difficulties get in the way of your ability to be in your life roles as a spouse, as a parent, as a student, as an employee, then we begin to wonder about whether has this crossed the threshold into a syndrome as opposed to a bump in the road.
And so that there are some people, and we've had people on the show before. I'm remembering Dr. Cotton when he was on the show, who he was functioning in his job, but was having difficulty maybe functioning in his personal life then.
Right, so it occurs where some people can hold it together for periods of time, they can rally and get themselves going, but it's really looking at the whole sum of all areas of their life that way.
So that's what that looks like in adults. And we were actually talking earlier this week because when I first started graduate school in 1981, they came out with this groundbreaking news that depression can occur in children. And what I love about that news is that before 1981, they didn't think depression could occur in children. And so, which is amazing, right? It's amazing compared to where we are today. But let's talk a little bit about the idea of kids being depressed, because I think a lot of people out there would say, well, what does a 7-year-old have to be depressed about?
Sure. Well, of course, it's important to keep in mind that it's not always identifiable life events that leads to depression. Sometimes chemical changes happen in the brain for no obvious cause. And so to say, children don't have the stress in their lives that adults do, and therefore they can't be depressed is a red herring. But an important feature of a child and adolescent depression often is irritability or crabbiness, which often leads to behavior difficulties. And so oftentimes the presenting problem for youth with depression is behavioral acting out. It's so common that we don't diagnose some of the most significant behavior disorders for children in the presence of depression, because the depression so often contributes to behavior difficulties.
And so whereas the parent might just think like, oh my gosh, I have my hands full of what's wrong with this kid, that he just keeps acting out all of the time, it's not really the behavior, so to speak, it's the mood underlying the behavior then.
Well, it's a combination of those factors, and certainly we can all look at causes for those things, but the underlying mood, there is that kind of sense that the longer you stay down, the more you get used to it, and the more it kind of feeds itself. So the behavior, by not being good or rewarded, continues to lead to consequences or negative outcomes, which eventually people stop trying.
There is another brand of depression, call it brand of depression, seasonal affective disorder, and one of the things that I've been noticing is the days are getting shorter, and I think the other day we just had the even break between the 12 hours, but I think we all can we can feel it's coming. And Duluth is going into its, I think, 6 hours of daylight phase, heading towards our 6 hours of daylight. So talk a little bit about seasonal affective disorder for us.
Sure. There's a partially understood relationship between mood and exposure to sunlight. And certainly research tells us that as you move away from the equator and get to parts of the world where sunlight decreases, mood difficulties increase proportionally. I think in our latitude, it's about 10% of folks are subject to something diagnosable on the seasonal affective disorder spectrum. It tends to look a lot like typical depression with some sort of special flavors to it. Sometimes a lot of carbohydrate intake, excessive sleeping, difficulty getting going in the morning can be some tip-offs that this may be a seasonal affective disorder.
And how is the treatment for seasonal affective disorder different then?
Well, certainly there's been some real helpful information around using lights and having that as another tool in our toolkit, so to speak. So the use of light therapy should be done before the sun comes up in the morning, and it needs to be at least a half an hour of exposure to very bright light. And the research always references a degree of light that most electricians tell me they're not familiar with. But light boxes are high intensity. The term that was always thrown around, at least when I was in training, is this 10,000 lux power behind a light that, as I say, I haven't found anybody to really quantify that in terms of watts or other things for us. But that light therapy has been helpful. Certainly there are other ways that we try to alter the environment to get people up and moving more.
And now this is what I've also heard about is that people are not just using it in the morning, they kind of have it on their desk and
Yep.
they're using it all through the day. And so
Well,
are they
and-
getting really, really happy then?
Well, I think there was an episode of Northern Exposure that showed someone in Alaska where their days get even
Shorter.
using one of these lights in a visor that they wore around all the time. Now, research, I'm not aware of anything saying that will lead to mania in people who are otherwise just suffering from depression. Now, people who may be prone to bipolar and having the other opposite reaction as part of their syndrome in life, that certainly, I guess, overuse is potentially something that might lead to kicking off a episode of mania.
So here in Duluth, because we're not Alaska, but we're pretty far north.
We're getting
Would
close.
we all benefit from going out and buying one of these lights?
You know, I think certainly when I moved back up this way from southern Minnesota, I noticed the difference in just changing latitude by a small amount. But I think it's different for everybody. And one of the things, people always ask me, well, can I get a prescription for light boxes? Insurance companies argue that people only buy them and use them occasionally, use them at the wrong times, and so it's not an effective therapy. But it takes a certain amount of getting used to and putting it into your schedule to be able to do that. And I haven't had anyone tell me that, I've never been diagnosed with depression, but I use a light box. But I wouldn't doubt that some people use it as a way to combat that kind of sinking feeling we all tend to get around this time of the year, whether we get the full syndrome or just partial.
So I'm hearing you say kind of no harm.
Seems
no harm
to
to try, seemingly.
Yes.
Maybe.
Maybe. I don't have any good evidence to back it up either way. So
Making you go out on a limb there.
there we go.
Dan, we have a caller who asked this question. How can a patient address suicidal concerns with his or her doctor without fear of the doctor stopping treatment for anxiety or ADHD, as an example?
Okay, I'll make an inference from that question that the fear is that the doctor will identify the treatment for anxiety or ADHD as possibly contributing to the suicidal thoughts.
That's what I would read from
Okay,
that.
well, we'll go with that. It is possible that medications that are prescribed for the right reasons, for the right causes, sometimes have side effects and can contribute to something like an increase in suicidal thoughts. That's not uncommon. But I would urge the caller not to be afraid of that. That would be good for the doctor to identify and do something about that. There are often a range of pharmacological treatments for lots of disorders. So if the identification is this anxiety med or this ADHD med might be contributing, then the doc might say, well, let's try this medication instead. So I would say don't be alarmed. A rise in distractibility from ADHD or anxiety is preferable to ongoing suicidal thoughts.
And I think people just in general are afraid of bringing up I'm feeling suicidal to their healthcare professional. And I have to say, I thought that's where this question was going. I didn't mean to throw you a curveball there, but
that's all right.
But let's talk about a little bit more. I'll hand you that question.
Yeah.
That question of just how does a person bring this up to their doctor, and especially if they're afraid, like, does this mean I'm going to have to go to the hospital?
Yeah.
What does this mean?
Well, it's a genuine and complex concern. One of the reasons for which we urge hospitalization for people is persistent suicidal thinking, especially with a plan. I think you bring it up the way you bring up any other difficulty. You're straightforward and honest about it, and you accept feedback about it, and you talk with the doctor about options, maybe short of hospitalization. If that's your goal, then you can talk about what can I do otherwise. But to be open to the fact that mental health professionals are obligated to urge hospitalization if that seems like the only step to protect someone's safety.
Yeah, and I would just add that I think it's straightforward, honest communication is actually helping the doctor know that you're willing to talk about it.
Yeah.
And it becomes more dangerous when people are doing things and family members are concerned, but they won't discuss it. And so, and that part leads to the other piece of it from my perspective, which when prescribing medicines for folks, I always bring up the discussion, and I encourage them to be in therapy as part of their treatment, which gives us the extra added time to talk to someone and to learn more about how you think about suicide, because that is an incredibly complex issue, as you say.
And I think that the idea of, you know, if we said, oh, I have a pain in my right side to the doctor, and if it's a big pain in the right side, we're not afraid about going to the hospital to get that taken care of if that's what the doctor recommends, right? And we can sort of think about mental health, the treatment of mental health in the same way, and certainly the treatment of someone who's suicidal in the same way, is that this is to get you through this very, very difficult time that you're experiencing, because we think if you get help for that, you will no longer want to kill yourself.
Exactly. So that's, you know, appendicitis, which your signal symptom was indicating, is most people would want to have that taken care of before it ruptured and caused them ongoing weeks and weeks of hospitalization and tubes and nasty things. Similarly, we need to survive, and if hospitalization is a way to make sure that people are getting through the initial part of depression and get better again, that's what we're looking for.
Dan, Dr. Bauer brought up psychotherapy as being, you know, a co-worker with medication for the treatment of depression.
Yeah.
Talk to us a little bit about what is effective psychotherapy for the treatment of depression.
Absolutely. There's lots of different therapeutic approaches that have shown to be effective. They tend to involve elements of helping people understand how they're thinking about their difficulties, what assumptions do they make about their functioning, how do they respond to their symptoms, how do they talk to themselves and others about their symptoms. Often an effective part of therapy is behavioral, in which we prescribe certain behaviors or activities, a regular sleep schedule, a good diet, exercise, exposure to sunlight, conversations with supportive people. So assessing thoughts and helping the client identify how thoughts might help sustain the depression, and then prescribing behaviors that research tells us can help lift a depression.
And there is this whole sort of resurgence, I call it resurgence, towards behavioral activation therapy, that notion that when you're depressed, it feels like I can't even get myself up out of bed. You know, patients describe feeling like I'm glued to the bed and having to repeat to themselves, there's nothing wrong with my bones and muscles, because it feels like there's something wrong with their bones and muscles.
Right.
But the idea of get out and do something. And how do you get a person to get out and do something who feels like they're glued to the bed?
Great question, and I think when we get a chance to meet with them and assess what's going on, and that's a complaint, those are the folks where quite often medicines can be very helpful in allowing you then to participate fully with the rest of what we know is going to help you.
Mm-hmm.
Be that therapy, be that getting up, getting exercise, getting out, getting sunlight, all those things that are important, but quite often people are just at that point where on their own they can think those thoughts, but the glue is tough enough that it's hard to get moving. And most antidepressants have some level of activation associated with their benefit. And sometimes that's great, sometimes it's okay, and sometimes it can feel wrong to people, but those are some of the physical symptoms are much more likely to respond to medication that then allow you to keep going and make more progress.
And participate in therapy then.
Exactly.
Here's a caller, Mike called in saying, I have a friend who's being treated for depression. She has no motivation, kind of what we were talking about a little bit about, socially or academically. How can a friend help her?
First, lead with concern and care. Sometimes we find ourselves getting, when we're well, irritated with people who aren't well. And we lead with, why aren't you doing X? We lead with criticism, even if we don't mean to. So take a special care with your approach to this person. I'm concerned about you. I want you to be able to do better. Let's talk about what you're experiencing. And then in the course of the conversation, maybe you get to offering various avenues of help. But start a non-threatening conversation by leading with care.
I love that approach, which is that it's not that you're doing something wrong. I think that whole notion of you don't seem to be yourself, and that must be hard for you, not being yourself.
The attitude towards depression, like many mental health difficulties, that I find most helpful is the attitude that someone is suffering, rather than doing something wrong or thinking incorrectly, but suffering with something that afflicts them. And people tend to respond if you approach with that attitude.
Rather than why can't you just pull yourself up by your bootstraps?
Right, something that's been discussed time and time again, and sometimes it's really the patient's own internal dialogue, that's what they assume people are saying to them. So you have to take special care in trying to be less threatening in any way, shape, or form, and much more approachable and present and able to be supportive.
Susie from Hermantown asks, what should I do if I think my loved one is depressed but they won't get treatment?
Much the same advice as we offered the last caller. Express care and concern. Point to specifics that seem to have changed. You're not yourself in these areas of life. What do you think is going on? So asking some questions to elicit their explanations, and then maybe offering a different perspective. I think it might be this. I worry about your mood. You seem less optimistic, less open to new things, what have you.
And go ahead.
Well, and I think the part of finding out why they're resistant to getting better. What is it that is preventing them? Is it that they fear the hospital or those kinds of things? Sometimes you can help with that.
That's right.
And I think that a part of that too is that if you tie, Dan, that suffering into it, right? That you are suffering needlessly.
That's right.
And it hurts my heart to watch you suffer this way, as well as, geez, if you had a medical problem, you'd go to your doctor for that, if they would go to their doctor for that.
Yeah.
So in maybe in northern Minnesota, we have too many of those stoic
There are some.
Norwegians, the Norwegian bachelor farmers.
We learn a lot from people in that situation, and they've been able to persevere and overcome, and they need to be credited for being tough, but they do lose a fair amount of time that could be otherwise enjoyed.
Here's a caller who expresses concerns about doctors who prescribe multiple medications at the same time.
I think that's sometimes too common a practice, certainly when people start out. As people have heard of newer medicines, one of the great benefits of the newer medicines is they're more selective, meaning they have fewer of the side effects. So as you referenced back earlier in time, when
Back in the dinosaurs.
when we started training, we had older medicines that are effective but had a lot of side effects. And so quite often I'd have people tell me, boy, I'd rather be depressed than take these medicines because I can't get the tongue off the roof of my mouth, or I'm dizzy all the time and I feel tired, and I'm gaining weight and those kinds of things. So some of the newer medicines are more selective, but unfortunately then they don't fully treat as much as the older medicines might have. And so there is a tendency of some folks to kind of combine some of these very selective medicines, and then sometimes we're seeing people just putting a whole bunch of medicines together, partially because there is this concept of if I'm not doing well, I need more medicine. And I try to help people understand that quite often it isn't just the medicine, it's therapy, it's these other things that we've referenced that would be very helpful rather than more medicine.
Dan, we're almost out of time here. What is the parting message that you would have for our viewing audience just about depression?
Maintain hope. Most people, the vast majority of people, get better. They get through depression. Talk with people you trust and care about. Have the courage to get treatment. Push back against the stigma of treatment for mental health issues.
I think that is a wonderful message to end with. That whole notion of pushing back against the stigma for getting treatment for mental illness. It is an illness, just like that diabetes I was talking about, and just like diabetes, we can treat depression. I mean, it's the most common mental illness, and it's a very treatable mental illness. So please get help and encourage your loved ones to get help. And thanks so much for joining us on our first show of the season. Loved having you here. Don't forget to visit us on the web at speakyourmindonline.org, where you can find a schedule of our topics and resource links, and read my blog, the place where I answer more of your questions and throw in a few more facts for you. You can also email us your questions about next week's show, when we'll be talking about addictions and a program that can transform lives and keep our community safe. Now, that's a win-win situation if you ask me. I'm Dr. Carolyn Phelps. Thanks for watching, and good night. I know. Do you like it?
It's an improvement.
Isn't it? Yeah.
Certainly by the end of last season, I was done with that music.
I was done with it kind of by the end of the first season, and it went 2 more years.
I'd expect. I think those are the kinds of folks want to hear about.
They do.
So,
Do you want to do a run through of the promo?
Yeah, I think we probably better. We ready?
Yep.
I'm Dr. Carolyn Phelps, host of Speak Your Mind. Addictions can have far-reaching impact, not only on the individual, but for their families and communities. Now, an innovative approach has the ability to transform people's lives and keep our community safe. Join me and my panel of guests next time as we talk about addictions, Thursday night at 7:30 on PBS North.
Ready to
I'm Dr. Carolyn Phelps, host of Speak Your Mind. Addictions can have a far-reaching impact, not only on the individual, but for their families and our communities. Now, an innovative approach has the ability to transform people's lives and keep our community safe. Join me and my panel of guests next time as we talk about addictions, Thursday night at 7:30 on PBS North. It is.
You can
The-
repeat the second one if you want to.
What? Oh, is there another one?
Yeah,
Oh,
Different promo?
is a generic one you can go through.
okay. Hi, I'm Dr. Carolyn Phelps, host of Speak Your Mind. It's a new season for our show, and I hope you'll tune in to learn more about mental health issues and how they affect us and the people we care about. Each week, a panel of guests join me to answer your questions about mental health problems like depression and anxiety, and we